apical periodontitis, periapical abscess, reversible pulpitis, irreversible pulpitis. Yes, you heard it right. So let's break down these complex terms into simple, easy to understand explanations. And welcome back to my channel. Hit the subscribe button and let's dive in. So pulp and periapical diseases that we encounter in our OPD. So let's start. Let's begin. Caries in the enamel region only. No symptoms. Just look into the picture. If caries is confined to this region only, means in the enamel region only, there will not be any symptoms. Only discolored area will be there. Okay. Now let's see what are the signs. There will be catch and softness at the base. Now what do you understand by catch? If you will run your explorer inside the cavity or in the carious region, it will feel resistant. Okay. So that will be the catch and softness at the base. So this is called dentinal caries. If the caries has involved the dentine, then what will be the symptom? The patient will feel sensitivity to hot as well as cold. Now let's understand this. There are basically three major reasons why patient have hypersensitive or why patient feel hypersensitivity. These are very important. They are very frequently asked in Viva. The reasons, what could be the possible reasons for hypersensitivity? So first is the dental caries involving dentine. Means dental caries has reached the dentinal region. Okay, it could be because of that. Second is wasting disease. You must have studied about adhesion, abrasion, affraction. So all these are the wasting diseases. Now the third is periodontal pocket or the recession. In case of the pocket formation or the recession, the root will get exposed and it will feel hypersensitive. So basically these three are the reasons why patient feel hypersensitivity. Now let's understand what do you mean by pulpitis as well as reversible pulpitis. Just look into the picture number 1, figure and figure number 2. Here the caries has approaching the pulp. Means it has not reached the pulp, but it is approaching the pulp. So in this case, it is called reversible pulpitis. Means the caries approaching the pulp. It is called reversible pulpitis. And what do you understand by word pulpitis? It means inflammation. Okay. So in case of reversible pulpitis, patient will feel pain. Obviously, in case of irreversible pulpitis also patient will feel pain. But in case of irreversible pulpitis, just look here. Here the caries has reached the pulp already. Okay. So if caries has reached the pulp, then it is irreversible pulpitis. And in case of irreversible pulpitis, what would be the treatment plan? Root canal treatment. The patient will go for root canal treatment. Okay. Now, in case of reversible pulpitis, it is of two types, acute and chronic. In acute, if the pain lasts for at least 7 days, continuously for 7 days, then it is acute. And the pain is sharp here in case of acute reversible pulpitis. And in case of chronic pulpitis, if the pain lasts for more than 7 days and the pain is dull in nature, this is the nature of the pain. If the pain is dull in nature, then it is chronic reversible pulpitis. I hope it is clear what is reversible pulpitis and what is irreversible pulpitis. So now let's understand how you will going to differentiate that if it is reversible pulpitis or it is irreversible pulpitis without radiograph. You have not shown a radiograph and now you have to differentiate. So for that we have heat and cold test. In case of reversible, this is reversible pulpitis. In case of reversible pulpitis, pain subsides on removal of the stimulus. So there will not be any pain if you remove the stimulus. But in case of irreversible pulpitis, here the pain persists even if you remove the stimulus. So this is how you're going to differentiate between the reversible pulpitis and irreversible pulpitis. Now this is very important. Even at this stage also, if it is not treated, if your tooth is not treated, then it will lead to this What is this? Apical periodontitis. Now let's understand what is apical periodontitis. Till here, the infection was in the root. Now, since it is not treated at that stage, now infection has reached this area. I'll use different color. Now the infection has reached this area. This area means this area is pedial space, and this is your lamina dura. So infection has reached the periodontal space. Here the infection has reached the periapical region called apical periodontitis. It is a sequelae of dental caries. Now let's understand what will be the symptoms of apical periodontitis. In case of it, the vertical TOP will be positive. Why? Because of widening of the pedial space. So there will be the widening of the periodontal space. And if it is still not treated till here, it will lead to periapical abscess. What is periapical abscess? It is a ill-defined radiolucency at the apex. Just see here. This is the root. Okay, this is your lamina dura. And there will be breach in the continuity of lamina dura. So there will be breach. Till here, the infection was here. Now, since it is not treated at that stage also, so infection has reached here. So there will be the ill-defined radiolucency in the periapical region. So this is periapical abscess. It is also of two types, acute and chronic. In acute, let's see what will be the signs and symptoms. Deeply carious. There will be swelling. Vertical TOP is positive. And very important, star mark, vestibular tenderness will be there. Vestibular tenderness and obliteration will be there. This is the feature which you will not find in case of apical periodontitis. So it is very important for you to memorize. Now let's see what happens in chronic periapical abscess. It will also be deeply carious and sinus tract formation will be there. In case of chronic periapical abscess, there will be a sinus tract formation. So it will lead to pus discharge. Okay, so that's it. I hope all these terminologies are clear. What are the reasons for hypersensitivity? What do you understand by reversible pulpitis, irreversible pulpitis? How you're going to differentiate if you do not have radiograph? Then apical periodontitis, periapical abscess, and about acute periapical abscess and chronic periapical abscess, about sinus tract formation, vestibular tenderness. Okay, so that's it. Thank you so much, and let's meet in the next video.